team of experts, we have come here to assess the PPEs that we are supposed to be used by our healthcare workers to protect themselves from contracting infection and to protect the public from also contracting infections. So either way in transmission on both sides. As we have observed, we have seen work in progress. There's excellent work going on at GTZ, although there's a slight gap which we have noticed as a team of experts, and we have asked them to rectify what we have observed, and we come back here on before the end of the week to verify once more so that it meets the standards that we set for them. Thank you.
Just one more question. Is it the first time that they are producing these PPEs en masse, or is it first that you have to approve them before they are dispersed to the end users?
Also, what is the slight gap that you
What is that slight gap?
One thing, when we gave them the specifications as a government, the specifications underwent the KEBS standards, and they passed. After them passing the standards, we asked them to bring the item for verifications once more, which they did. And as a team, we felt we should have a larger team to come and look at what they have produced. We are happy with what they have done, but the only gap is this slight penetration of water. And that is not a big deal. That is something that can be done within a very short time.
Let me just ask about the numbers and the capacity that Shona has, and perhaps how many PPEs have already been dispersed.
I think with that, I would ask Isaac to come and respond to that question, because he's the one who is dealing with the manufacturing.
Okay,
Isaac.
Okay, Isaac. Please, your full name, perhaps your position as well, and how many PPEs you've been able to produce, and what is your capacity on a daily basis?
My name is Isaac Maluki. I'm the director of Shona EPZ. And in terms of the capacity for PPEs, we can do about 20,000 coveralls per day. And if need be, then we can double up our production capacity.
20,000 overalls?
Yes.
About the mask, I mean the whole set?
The whole set, we can do 20,000 of each per day.
And how many have you done so far and distributed?
Currently, we are making for testing so that they can get approved. Once they have been approved, then we will go into the bulk production.
Okay.
Yes.
Just to add something, that what the government is doing here is to be able to get PPE that will eventually get even to the healthcare workers at the county level. And therefore, we are also asking the county health officials that all the purchases for PPEs should actually be those that meet the standards and specifications that have been set by the Ministry of Health, so that all of us and all of healthcare workers can have equipment that can be able to effectively protect them, but also provide them with a good working environment that can give them the confidence to manage our people. Yeah.
I have a question. Currently, how many local factories have you approved to manufacture these PPEs?
Yeah, currently there are 3 local factories that are making this equipment. We have the Kikotech in Kitui, there is Bedi in Nakuru, and there is Shona here. Like the CEO Shona did indicate that they're actually in the process of preparing, prototypes that once they've completely approved, then they'll now go into mass production. So right now it's actually, putting together a prototype.
Those in mass
But the
production?
good news is this, is that looking inward, help us to be able to untap potential that previously we had not been able to even think that we have. And therefore, that potential being tapped also provides an opportunity for employment of our people who otherwise would be jobless, considering that, this corona situation has destabilized many businesses and even enterprises. So it is like every dark cloud always has got what? A silver lining. So we probably say that looking at inward also provides a silver lining that some of our people who right now would be at home are actually currently being engaged productively.
Okay, on the same line, we have seen some hawkers selling these masks, and some are not wrapped. How safe are they, and where are they coming from? If you have identified some gaps in some of them.
Yes, very well. That's a good question. I'll leave Dr. Eva to address that.
Yeah. Good morning. Yes. My name is Dr. Eva Jenga. I'm the chair of the Kenya Medical and Dentist Council. We've been working collaboratively, even with the Kenya Medical and Dentist Union, with the Ministry of Health. And I think the issue of masks is very, very, very crucial. And I can see you are wearing everybody here is wearing a different style. You seem to be wearing one of N95. And N95 is not for common use or even for community use. This is the mask that is supposed to be left for the health professionals on the front line. This Shona is making also community masks. Community masks, the idea is to protect you from passing your droplets to other people around you. Then you have the surgical mask. The surgical masks are what also they have a different level of protection. What you have said about how good are these masks? We need, even the public health, we need to have regulation of who is distributing these masks and who has the approval to produce masks en masse. Because some of them